guys, Lauren and Rebecca here with Bizrok. In today's video, we're kind of talking through the continuation of a clinical or team optimization training. And today is all about the exceptional appointment, which Rebecca, you know that's like my favorite word ever, right? Because exceptional means going above and beyond and over delivering. So what does it mean to you as far as the exceptional appointment goes? Like what specifically should they be focused on?
Exceptional appointment needs to be every appointment that you see with the patient, guys. No matter the situation, make sure it's always an exceptional appointment for the patient. That's who it's about.
Yes.
So it starts with setting up. Even for emergency cases, those are a little bit different. So we'll kind of start with the emergencies and go to the scheduled appointments.
Okay.
Emergency cases normally if somebody's getting rushed in either from the reception area or from another chair. So when they come into your operatory, normally it's get out of the anesthetic and let's get going.
Yes.
That is perfectly fine, but we also need to slow down to make sure we hit everything that we need to set out. We never want to start an appointment and forget something. The goal is to not get up.
Yes.
So with an emergency appointment, you can start your anesthetic, and then as you're speaking to your patient and going over their medical history and reconfirming the treatment and getting out everything that you need supply-wise for the appointment, then you will have them know that you are ready and go get the doctor. But if it's an actual scheduled appointment, please make sure everything is set up first. Everything.
So
Because
good.
you don't want to have to get up and we don't want to be fumbling around behind a patient's head. They can hear everything and they kind of see us. Y'all know what I'm talking about. They're staring behind them. You see their eyeballs roll in the back. They're trying to see what we're doing. They can hear every little thing. We need to make sure it's all set up properly for them.
I love that you're talking about this because, it's no secret that most patients don't love coming to see us, right? They're nervous or anxious about being at the dental office, but it becomes even more nerve-wracking whenever the one person, the one contact that we have in the office leaves us alone in the operatory. And I always cringe when I see that, especially clinical team members like coming and going from their operatory. I'm like, your job is to serve the patient and make them feel comfortable and confident. So being proactive and preparing for your patient before they come in. Now, sometimes, I know you've seen this before, but sometimes the doctor's like rushing them to take care of the patient and like just get the patient in the operatory. What are your thoughts on that? Like, what's the best way to handle that?
Go ahead and start with anesthetic, and then when the doctor gets up, tell the patient you'll be right back. Do not ever just walk out of an operatory without telling the patient that you're going to step out for a moment and just go tell your doctor that you need a few moments, that you want to make it about the patient. Always speak your mind, because the more you hold back, the tenseness is going to grow and the patient's going to feel it, no matter what. They feel it. They know. So make sure you just communicate with the doctor that you do need a few more times. As a clinician in the back, you always know your steps. And if you do not have time to go through your steps, you're going to forget something.
Yes.
And the worst thing ever is to get up in the middle of a procedure to go get an item that was forgotten, or if you were to drop something and not having the extras that you need. Guys, always keep extras, at least some basics in your operatory. If you drop something, please don't say oops or I'm sorry. Just keep on going with the procedure. You can always apologize to the doctor afterwards, but we're all human. We all make mistakes. We just don't want it to be noticed by the patient. So drop something and just keep on rolling. Grab your extra instrument that you have and don't stop. The patient will have no clue anything's going on. But if you say I'm sorry and oops, especially more than one time, the patient's gonna be like, what's going on? So it's all about keeping them comfortable.
I think that's so important. And I know we spend a lot of time talking about best practices and checklists. And, sometimes I know it's like, gosh, they talk about checklists for days, but, those checklists and those best practices are there as almost like a stopgap to like protect you so that you don't have to remember, because sometimes as a clinician, there's so many things to remember, what instruments are needed for different procedures. So will you talk a little bit on best practices for the clinician?
Yes, best practices are amazing. Checklists are great. In your 12 o'clock unit, I always suggest the top cabinets. If you open up your cabinet, place your checklist there. In a laminated sheet, the patient does not see them, but that way it can help you set up until you have everything memorized, especially if you change something or have a new procedure. If you have a new laser in your office, sometimes it's hard to switch from the old laser and the protocols for that. Have everything listed on your 12 o'clock cabinet. That way you can go and refresh your mind when you're setting things up. Best practices are so important. I think that they are important throughout the entire office, but in the back, they are so important because you want every single clinician to work the same and to know what instruments to have out. If you don't, it's not going to run smooth. The doctor expects things at a certain time, and we just need to hand it to them without any verbalization. Just hand it to them and keep going. So when you get your best practices done, I also want to say refresh those every 6 months. I need you to look at them and keep them up to date. One, we get new technology, and the other things change. We may start using a new product, or we may decide, you know what, something else works better than what we've been doing for years. change them up. It's okay to redo them. They're not set in stone, guys. Every 6 months, look at your best practices, update them, and then as a team, I would say at least once a year.
I love that. And if you're actually following some of the Bizrok training guides, we recommend trainings every 2 weeks. And part of our training guide, we talk about bringing up 3 different best practices. And I think it's set up so that it's happening every 6 weeks. So imagine that every 6 weeks, you're revisiting different best practices. And Rebecca, you mentioned having like a cheat sheet in the 12 o'clock unit. I think rotating those based on, new changes or different technology until team members get used to it is a really, really great alternative for having to memorize everything up here.
Absolutely. Absolutely. We all have a memory capacity that fills. So when we have to add something new to it, just know it's okay to have a cheat sheet. 25 years in, I still sometimes have to revert back to notes on things. It just happens, guys. When you get new technology, it's hard, especially for us that have been in dentistry for so long. The new things, it's like, okay, I can do this. Don't feel ashamed. Open up your 12 o'clock and look and get it set up properly. Your doctor will love that you're actually taking initiative to learn something new and not put so much pressure on yourself to have it memorized right away.
I love that. Well, guys, if you need any help, please reach out to us. Rebecca, thank you for today. This was really awesome. As always, guys, we're here to help and serve you in any way. Please reach out. Otherwise, we can't wait to see you and serve you soon.